As we go back, we notice that the research has quite a bit of information regarding communication and how it leads to patient adherence in treatment. That's a big deal. You want your patients coming back more often. And it turns out that when your patients come back more often, they get better faster. A good way to get bad results is don't have people come back. There's also the studies of using mobile apps and text messaging. That seems to be a very positive thing. There is not a positive relationship with email messaging, by the way. And then finally, if we look at best practices, we get to those behaviors, opening up for questions, communicating before the visit, making sure we validate the patient and their feelings and their beliefs, and yet still work together to find a solution. So the research is clear. It's important to communicate via text message before the initial exam. Why do I say communicate via text? Again, there is no research saying that email leads to positive outcomes. Text, there is a lot. There's quite a bit of research saying the text messaging leads to better outcomes. It's in every research project that I looked at, every one of them, SMS messaging is a positive outcome or creates positive outcomes around many things: lower pain scores, higher adherence, better understanding, less annoying phone calls, or less overscheduling by concerned parents. Text does well, email does not. Why is that? I think at its very core, the issue is text messages get delivered at 95% and get about 93% of messages that are delivered get read. Whereas if we look at email, it falls down to 20% at best. Sometimes it's 15 to 20% get opened, even fewer than that get read, and even fewer than that get replied to. Text message cuts through the clutter if you use it right, and it's actually communication. Also, two-way text messaging is great to encourage questions. Sending your patient a message before their first visit saying, "Hey, we look forward to seeing you, and be sure to bring any questions you have with me." A simple line like that, "Be sure to bring any questions you have," opens up that communication strategy so they can ask questions. Now, one of the things that's important there is if you're going to encourage questions, you have to then also encourage that the method you're using works. For example, two-way text messaging, they can reply and ask the question right then, or they can respond and say, "I will be sure to bring them." This doesn't work if you're using one-way text messaging. One-way text messaging, like a lot of EMRs offer, doesn't allow for that response. And in fact, when the patient responds, they typically get a message saying this isn't monitored, which tells them don't ask questions, right? It shuts down that line of communication and everybody loses. So it's important to encourage questions and at the same time, allow for a pathway that has questions as well, and that means two-way text messaging. Third, to overcome those barriers to anxiety and those barriers of language, using pictures seems to be a much better method than just words. For example, send a map link. A map link will work in many languages. Send a picture of your office. The picture, as they say, is worth 1,000 words, and it doesn't even have to be there doesn't have to be an accompanying language component of it. Just circling the door to your office or drawing an arrow on that, it spans all languages. So using those pictures as often as possible seems to create some better outcomes. You can also send pictures of the condition or images that you think help those patients understand their condition, and that seems to break down those barriers, reduce anxiety, and lead to more accurate histories, which is what this is all about, right?